welcome to Lawndale Lifestyle, the show about everything health and wellness in Lawndale. I'm your host, Christine Bou Sleiman. Today we're going to be talking about the influences of marketing to children. And today with me we have Dr. Paul Simon, Pediatrician and Director of Chronic Disease and Injury Prevention at the LA County Department of Public Health. We're so excited to have you.
Thanks so much.
Today.
Happy to be here.
Thank you. Can you please tell us why companies market to children and what are some of the most common reasons why they market?
Well, obviously the food industry is a very competitive business and they're in business to make a profit, and so they use marketing strategies to maximize the sales of their products, and that may be very good for their companies, but it doesn't always work so well for children and adults because so many of the food and beverage products out there aren't particularly healthy, loaded with fat, sugar, salt, calories. The marketing really works against the health of our children, unfortunately.
Wow, I'm sure a lot of people don't notice the marketing tactics out there. What are some of the common foods that are marketed to kids?
Well, it's true, they don't often notice. In fact, I think we're so bombarded with advertising and marketing messages that we just don't see it, but nonetheless it does influence our purchasing. And in fact, the industry wouldn't spend so much money if it didn't influence what people buy. It's surprising to many folks when they hear this statistic, but actually the food and beverage industry spends about $1.8 billion a year marketing their products to children. And so they certainly wouldn't spend that sort of money if it didn't work and influence what families purchase. In terms of what sorts of products, the restaurant and fast food industry probably accounts for the greatest share of those marketing dollars. About $750 million actually is spent marketing those products and services to families and young children. Carbonated beverages also marketed very heavily, and snack foods also marketed very heavily.
Yeah, I noticed that. I have 2 kids under the age of 5, and it's hard to go anywhere without being attacked by all the marketing tactics out there. So how does this negatively affect children? How does marketing affect them?
Well, again, it's unfortunate because kids are very vulnerable. They don't recognize the difference between advertising and information that's just being shared to teach. Mm-hmm. And so they're very easily manipulated, and as a result, they are literally sponges. I mean, they absorb this information from a very young age. In fact, there have been studies showing that children as young as 2 years of age have very, very strong brand recognition and preferences. And so it influences what they want to eat and drink. And while parents have a responsibility to, create home and food environments that are healthy and to serve their children healthy foods and beverages, it's tough on parents because there's the so-called nag factor. Mm-hmm. Kids really can continue to pester and pester, and at a certain point the parent just succumbs. Mm-hmm. And so the influence, I think, is that children don't eat as healthfully as they ought to for their health. At a very early age, they develop preferences for foods and beverages that are very sugary, mm-hmm. Food products that are, again, chock full of salt and also high in fat content. And as human beings, we're sort of wired mm-hmm. to prefer those sorts of foods. And when they're introduced at a very young age, again, children develop very strong preferences, and then as they get older, it's very hard, I think, to change that pattern of eating. So the reason we're focusing so much on young children is because that's really a window of opportunity, we think, to try to influence dietary preferences in a favorable way.
Mm-hmm. So you mentioned a lot of influences. Is there also a link between obesity and marketing?
Yes, it's a tricky thing in research to identify a direct link, but certainly indirectly it seems pretty clear. Studies showing that the exposure to advertising of unhealthy foods and beverages leads to increased consumption of those foods and beverages, and in turn there have been a number of studies that have shown a relationship between consumption of those foods and beverages and obesity. We're very concerned about childhood obesity. It's very alarming, actually. We're seeing rates of obesity among young children, for example, 3 and 4-year-olds in the county, that are up close to 20%. So
Wow.
1 in 5 children at that very young age already fall into that obese category, which is nearly as high as the obesity rate we see among adults, which is close to about 25% in the county. And what that tells us is that this problem of obesity and overeating, overconsumption of calories begins very early in the life course. And we at the Public Health Department are very interested in prevention. We'd much rather help folks avoid the sorts of health conditions that are associated with obesity, things like diabetes, heart disease, stroke, and much easier to prevent early in life than to have to try to treat these conditions after they've developed later in life.
Yeah, and with all these marketing influences, is there a recommendation for the amount of screen time that children should receive?
Yes, the American Academy of Pediatrics actually recommends that children get no more than 1 to 2 hours a day of screen time.
Wow.
And what that means is television, but used to mean just television, but of course today there are lots of other screens. There are things like iPads and even cell phones, which kids often use to watch shows or to just play. And if it's for entertainment, it really should be limited to no more than 1 to 2 hours a day. If a child's under age 2, parents should really strive to avoid it altogether. We know that many children actually have televisions in their bedroom, which is not a good thing.
Yeah.
We really strongly recommend that parents try not to do that. There have been interesting studies that have shown that kids that do have televisions in their bedrooms actually are exposed much more heavily to advertising and have much stronger brand recognition and have stronger preferences for, again, the unhealthy foods and beverages.
Wow. And before I had kids, I thought 2 hours sounded like a lot. But now that I have kids, I can see how easily those hours can be eaten up, especially if they're early risers. So it is definitely something parents need to be aware of and mindful of. Do you have some tips for parents on what they can do to help combat the marketing influence on their own children?
Sure. Well, there are a number of things parents can do. It's very challenging, I think, though. One of the reasons we're working on this initiative, Choose Health LA Kids Marketing Matters, is because the environment in which kids are raised makes it very difficult for parents. Parents have control over their home environments, and in the home, there are things that can be done. For example, as we've just discussed, not letting a child have a television in their bedroom, or monitoring and regulating the sorts of programs that their children watch. For example, watching PBS or other stations where there aren't commercials, or choosing stations where there are minimal commercials, or if it's a matter of, Netflix or something like that, or other venues where kids can see programming, parents should actually watch with their child and make sure that it's programming options that either have no marketing or minimal marketing. When it gets to outside the home, it's actually much more challenging. You can't regulate what your child looks at, and children are literally bombarded with these marketing messages everywhere they go. And that's why Choose Health LA Kids Marketing Matters is as much about what parents can do for their children. More than that, I think it's about what parents working together can do for their communities.
So is this a resource that parents and other community organizations can get their hands on if they want to help combat the influence or combat marketing to kids?
Absolutely. We have, as part of this initiative, which I should say is funded by First 5 LA, we've, with these resources, have been able to work with 20 community organizations around the county. These organizations, in turn, are working with families and parents. Each has a parent collaborative. So I would urge folks in this community to look for your parent collaborative. If you want materials, we have a whole toolkit, Marketing Matters Toolkit, that's available from an organization called Change Lab Solutions. They have a website, www.changelabsolutions.org. The toolkit actually includes specific information for parents. Also for another part of the toolkit is information specifically for community organizations.
Oh, great.
And another actually for policymakers.
Oh, wow.
Because we want elected officials and other policymakers to be aware of this problem. We're really encouraging our parent collaboratives to establish a dialogue with their elected officials. It can be with school board members, city council members. It can be with community leaders or business owners.
Wow.
For example, parents could come together and work with a local restaurant or a grocery store to minimize or eliminate the unhealthy food and beverage marketing in their venues.
Well, this is great. It's so nice to know there's an actual resource to turn to. So hopefully our viewers will get on the website and check it out. So
Great.
Thank you so much for coming in today.
Thanks very much for having me.
Thank you. And we'll be right back right after this. Welcome back. Earlier we talked to Dr. Simon and heard about the influences of marketing to kids. And with me now is Gisella Cortes, president and parent from the Wellness Club from Choose Health LA Kids. Thanks for joining us today.
Thank you for the invitation.
Can you tell us a little bit more about the Parent Wellness Club and why you decided to become president?
Sure. I'm very excited first to talk about it. Thank you for the invitation and giving me the opportunity to talk. The wellness program is actually part of the children early childhood obesity prevention initiative, where parents like myself and part of the community members work together with CH LA Kids staff to promote healthy eating and physical activity. So through the process of the program, we are offered with nutrition and physical activity education. We also get provided with different resources, and we have been participating in things such as live cooking demonstrations, where we have access to very healthy recipes, and we were very lucky to try a lot of those recipes. And let me tell you that I was really impressed to know that we could eat healthy and manage our weight while eating something that we like. I didn't know that, but we have to be very creative. And we also have the opportunity to have a guided tour to our local grocery store, where we actually explore like the different options of different healthy products that we could incorporate in our meals.
Nice.
And we learned the importance of, how do you call those labels?
The food labels?
Yeah, that is very important to check the food labels, because it's amazing how they are very different from what it is advertised. So we also had the opportunity to work with the staff on learning how to reduce stress. We learned different techniques that were very efficient and very quick techniques. So I decided to become a president for this club because I needed to develop some leadership skills to be able to talk about this with the community. Usually I'm part of the policy council at my son's school, so I wanted to have this opportunity to be able to be mediator between the school, the community, and your club.
That's great. So sounds like a very active group of parents. So I know the Photo Voice project involves pictures out in the community. So based on the pictures that you guys took, what did your wellness club decide to focus on in the community?
Well, in the pictures that we took, we came with the stories of what the purpose was, but to mention some of them, there was a couple of pictures that stood out in the whole project. One of them was one that was marketed to kids. There was like chewing gums or candies, and they were with the box of cigarettes.
Oh, wow.
So what we're trying to promote is to tell the retailers to offer more healthy choices, especially on the aisles of the stores, like on the checkout aisles, to promote more healthy things and promote more fruits and vegetables for children as well. And it would be great too if that is one of the other steps that we want, is to have more healthy menus on the restaurants, especially when we are talking about low-income families. They have to go, they have no choice but going to the fast food restaurants, and they not always have the most healthy choices over there. So we really need the support from the decision makers to implement campaigns to support our efforts to have healthier lifestyles.
So do you have any tips for parents like you that want to make a change in the community? What can they do?
Well, first of all, become a voice for your community, for your family, for yourself. Try to get engaged with groups that promote healthy behavior. And also, there's a lot of tips that I could do and talk about, but they can start by going probably to their grocery stores and talk to their manager and ask them, suggest them to have, as I said before, healthier advertisement for children, to focus on that.
Yeah, that's great. Thank you so much for being a leader and leading the way for a healthier community. We need more parents like you out there.
Thank you. I want to thank all of all the people that are behind this, because that makes a big impact for our community, our kids especially.
Thank you. Keep up the great work.
Thank you.
And we'll be right back right after this.
Secondhand smoke affects everyone's health. It's not just irritating. It can cause heart disease and even death. Speak up about secondhand smoke. Your health and the health of your family depend on it.
Change can happen in the community, but change can also happen right in your own kitchen. Let's see what Chef Lissette has for us today.
Welcome back to Lawndale Lifestyle, cooking with Chef Lissette and company. I have two sous chefs today, Madame Jocelyn here to my right, and I also have Miss Sophie to my left. Thank you so much, ladies, for helping out today. We are going to be making a smoothie. Very, very simple. It is how many ingredients, girls? 1, 2, 3. 3 ingredients total. Super duper simple, super easy, and we're gonna get started right away. So, Miss Jocelyn, have you ever had bananas like this at home? Yeah? Do you like to eat them when they look like this? No, I didn't think so. They don't look so good. So today what we're gonna do is, instead of throwing these away, we're gonna cut them up and freeze them. Can you help me out with that? Yeah. All right, here you go. So we're gonna peel the banana, and we're gonna throw away the peel later. Actually, we're gonna use it for composting for our gardens, but that's another topic. And as soon as we do that, we're gonna cut up the pieces and we're gonna put them in the freezer. Once they're frozen, we're gonna pull them out and we're gonna add them to our smoothie, so that way we don't have to add any ice. But you always can add ice if you wanna make it a little bit frothier, icier, colder. Alrighty, so Jocelyn's gonna cut this up into a couple pieces for me right now. Wonderful job, thank you. And we're gonna arrange the pieces on a little piece of parchment paper, as you can see here, so that way the pieces don't stick to the tray when we freeze them. Now, could you put this in the freezer for me, please? Thank you. All right, so what we're gonna do next, we have a little bit of frozen treat already. Miss Jocelyn was helping me out a little earlier. So next we have our strawberries. Can you go ahead and help me cap a strawberry? Okay. And to tell you, to cap a strawberry is to remove the green part here. As you can see, she's just pulling it off. You don't have to pull out a knife to cut them. This is a lot faster most times. You just lift it and pull, and you're done. So if I could have that, thank you. And are you ready to add the bananas? Yeah. All right, let's go ahead and add the bananas. And could you go ahead and pour a cup of milk for me? Okay. All right, actually let's do a cup and a half. So to this line. So we're using lactose-free milk because some of us here can't have the milk sugar. Doesn't agree with us. But you can use almond milk, soy milk, regular milk. What matters is that you're using something that does not have any added sugar. It's totally natural, and that also has very, very little fat. So we're gonna go ahead and add it in here. All right, so you have that. And then can you come and add the strawberries? Okay. And we're adding 2 cups of strawberries. You can pick up the whole thing and just pour it on in. All right, go ahead. Wonderful. Okay. And we are ready to rock. A couple more pieces. We're good to go. Oh, one more. Toss it in there. All right, so as you've noticed, we're not adding any extra sugar. We're using really ripe bananas because they're very, very sweet, and we don't want to throw anything away. So now we're going to get it on here, and we're going to start it up. Can you go ahead and press the switch for me? Just flip it. We're going to stop it for just 1 second because it is pretty icy in here, and mix it just a little bit. All right. Can you hold that for me? Thank you. And one more moment. We're all done. So I'm going to pour a cup for my lovely companions today. And to let you know, you can make this with any ingredients you want. Remember, the recipe is 1.5 cups of milk, 2 bananas total, and 2 cups of strawberries, blended. And thank you so much. We'll see you next time.
Thanks, Chef Lissette. I can't wait to try that recipe with my own kids. Now let's all get up and get moving with Coach Latarrin.
Thanks, Christine. We know that nutrition is good for the body, but also physical activity is also good. So let's get off the couch and do a 5-minute instant recess. All right, everybody, let's go ahead and start moving our feet. Start warming up the body. Very good. All right, we're gonna take it to some nice shoulder rolls going forward, nice and high. Good, let's do both shoulders at the same time. Keep the march going, keep the feet moving. You guys are doing great. Let's count it up. 1, 2, 3, 4, 5. Let's go ahead and roll it backwards. Counting down. Make sure you're getting up nice and high. 5, 4, 3, 2, 1. Very good. Go ahead and shake it out. Good. All right, so we're gonna start off with the feet going step outs, going here and out. Step out and out. See that I'm not going, my hips are not going anywhere. I'm just trying to keep my hips in one space. Only thing that's going out is my legs, and we're gonna speed it up. You guys see that? All right, you guys got it. Good. All right, so we're gonna start off with some arm curls, doing the biceps again. Here we go, up, down, up, down. Let's speed it up. Good. Make sure you squeeze those biceps. We wanna feel that burn. Who says you have to go to the gym and start lifting? We can just do it right here. Good. Let's count down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Very good. Shake it out. Keep the legs going. Now we're going to get the arms going up. We're going to do also what's called a modified jack. So as the legs go out, the arms will go up here. You see that? Let's go ahead and slow it down. Out, in, out, together, out, together. Speed up. This is very important so you put less impact on the knees, but you're getting the same type of workout when you're doing the jumping jack. Good. Has everybody got it? Let's go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Very good. Let's go ahead and shake it out. Bring it back to a march. That is going great. You guys still with me? All right. So let's do some crosses. So what we're gonna do is bring the arms in, and we're just gonna punch as we're marching. Crossing the body. You guys got it? Good. Let's speed it up. Cutting like Rocky. Yeah. Keep it going. Let's punch up. You guys doing great. Oh. Let's punch it down. Good. Keep the feet moving. You guys doing awesome. Back to the middle. Very good. All right, and shake it out. All right, so we're gonna do now some high knees cross. Gonna bring it up, across the body and down. Up, across the body and down. Up, across the body and down. Across the body and down. You guys got it? Let's speed it up. Good. It's just crossing the body. Make sure you're up and high. Good. Just bring the arms up. And every time the knee comes up, we're going to snap our fingers. Good. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right, let's march it out. Let's cool the body down. We're gonna do shoulder rolls going forward. Let's do 5. 1, 2, 3, 4, 5. Let's take it back. 5, 4, 3, 2, 1. Very good. Let's do the next stretch. Going down, up, back, forward, down, up, back, forward. Let's do it to the side, side, middle, other side, middle, side, middle, other side, middle. All right, let's spread the feet. Let's do the cool out, some breaths. As the arms go up, breathe in through the, inhale through the nose. Arms go down, inhale, exhale through the mouth. Inhale through the nose, exhale through the mouth. Last one, inhale and exhale. Very good. Thank you guys for joining me. I'll see you next time.
Today we heard about the unhealthy effects of marketing to kids. We also heard about how change can happen when just a few parents mobilize to make a change in their community. To learn more about the Choose Health LA program, you can go to www.choosehealthla.com. And to get a copy of the Marketing Matters Toolkit that Dr. Simon mentioned, you can go to www.changelabsolutions.com. And to find out more about how you can get involved with tackling this issue of unhealthy marketing to kids, you can go to www.lawndalesd.net/wellness to find out what the Choose Health LA team is doing in your community. From all of us here at Lawndale Lifestyle, I'm your host, Christine Bou Sleiman, and we'll see you next time.